This is the Bloom Podcast. Your health is our priority. Welcome back again to Bloom Podcast. And today we are going to talk about this topic that normally disturbs and affects the young children, especially the men, and that is undescended testicles. My name is Joshua and we have our guest here.
Good morning. I'm Dr. Shihad Imad Amir. I am consultant of urology and male infertility at Bloom Hospital.
Thank you so much. Welcome. So maybe it's good for us to understand what exactly is the undescended testicles.
Undescended testicle, it is a specific congenital anomaly of the male infant or the male children in which we found that what is called an empty scrotum. It is either unilateral or bilateral, in which we can find either one side or both sides that are not present in the scrotum. So for those cases, we call it as undescended testicle.
Okay. So what is the main cause or the exact causes of these undescended testicles?
Actually, there is no definitive cause for the undescended testicle, but there is a lot of theories. Some of them talking about an hormonal effect through the pregnancy, especially for those women who receive contraceptive pills in the first months of pregnancy. And for those who, other theory talk about the length of the cord, the spermatic cord for the testicle, which is responsible for the blood supply of the testicle, it is short. Another theory talking about what is called the gubernaculum, which is a connective tissue band connected between the base of the scrotum to the base of the testicle, and it might be maldirected.
Okay. And these undescended testicles, is it easy to treat them? Can they be treated? And if they can be treated, how are we treating them?
Of course, so it can be treated, but before we go for the treatment, it is a must to make a proper diagnosis at the proper time.
Yeah.
So we usually say that the golden window for us to make the diagnosis and to make the treatment for the undescended testicle, it is in the first year of life. So we usually advise the mothers, the caregivers, the doctors, especially the pediatrician and the gynecologist who are the first people to receive the child, to examine the scrotum. Because if we found that our child has an empty scrotum, or we cannot palpate the testicle, it is a must or it is a better to seek for a medical advice with a urologist. Because as early as we can diagnose and as early as we can treat, we can preserve the hormonal function and the spermatogenic function of the testicle. Because after the first year of life, both of them are affected negatively.
You've heard very well that it's possible for us to treat it, and that it's good, you as a mother, also to examine your own child. And for that case, here at Bloom Hospital, we can help you in this journey. If you haven't joined Bloom Mama, just come and register and be a member, because with that, you shall see good packages, and also with that, we shall be able to understand and to know whether your child has any complications. So maybe, Doc, what advice can you give the mothers who are pregnant, who are expecting to have a child? Yeah.
Of course, Bloom Mama, it is a pure project for the pregnant mothers.
Yeah.
And this might be out of my specialty, but if I can advise, I will advise every mother or expectant mother to come to join the project of Bloom Mama, because it will give her and her child a best medical care, service and coverage throughout the journey of pregnancy and also in the postnatal period. And if your child has a problem, either it is undescended testicle or any other congenital anomaly, either urological or another, we can manage and we can treat. By the way, for the undescended testicle, we can make the proper diagnosis according to the site of the testicle. Because for the undescended testicle, there are a lot or many sites that we can find, either inside the abdomen, which is called intra-abdominal, or in the inguinal canal, or in other ectopic sites. So it is a must that we can, make a proper diagnosis for the site of the testicle, and according to this site, we decide which is the proper plan of treatment, either to make it surgical or a laparoscopic. And for the laparoscopic, it is a challenging maneuver, especially in the first year of life, because it needs a wide range of experience from the surgeon, a specific instrumentation, and also for the anesthesia doctor, it must have a wide range of experience. So all of these you can find here at Bloom Hospital. We have the equipment, we have the experience, so we can manage your child, and your child is in a safe hands.
Thank you so much, Doc. As you have heard from our consultant in urology, you as a mother or you as a father, kindly share this video to somebody else. And if you have any question, type in the comment section and be sure that we shall answer it. In the next episode, we shall be talking about male infertility. Stay tuned. Bye-bye.
Bye.